Facebook live session here at Bellevue. Good evening, everybody. Welcome to Bellevue. This is our next live session. We've got really packed information about facelift and anything face related this evening. I'm Amir Nakjivani, plastic surgeon here at Bellevue in Tunbridge Wells. And today we're joined by Hagen Schumacher, a well-respected facelift and plastic surgeon that joined us here at Bellevue, as well as one of our past patients, Benita, who's also joined us to give us some perspective about a patient's point of view with regards to some of the procedures that we do here at Bellevue. So without further ado, we're going to be going into this session. If you have any questions and comments, please comment them below. And please remember that all our consultations are free. So if you have any questions and you want to contact us, please do so. So it's starting the day. Hagen, welcome. How are you?
Good, and you?
Good to see you this evening. So I'm going to kick off and talk a little bit about you joined us here at Bellevue. We're very privileged to have you here. You're a plastic surgeon. We knew each other many years ago as trainees, and now our paths have crossed again. So tell me a little bit about your background. I know you have an interest in facial work. You do other plastic surgery, tummies, breast, etc. So tell me a little bit for the audience about yourself.
Yeah, so I'm Hagen. Hello, everybody. So as Amir just said, we did some training together. I trained in the Cambridge region to become a plastic surgeon, worked in the NHS, and developed an interest in head and neck surgery. Like yourself, I've been majority of aesthetic and reconstructive procedures, but my favorite area is the head and neck surgery. And we're talking about that today.
Yeah, and it's quite intricate, isn't it? So facelift surgery is really attention to detail. It's about not having something that's glaringly obvious, but a little bit here and there to make a big difference for patients. So I've prepared a few slides, and some of you, if you have any questions, please ask your questions. We've had some questions already sent in. We've been inundated with lots of them, but we can't go through every one, as you appreciate, but some of them we've picked for the purpose of this topic so that we can educate people more about the aging face and how we would address those. So I've got a slide here about the aging face. So Hagen, if you don't mind just talking us through how the face changes as we grow older.
Of course, yeah. Several things happen sadly when we get older. So that involves the skin, the deep tissues, and the bones. So what we can see here in this example is that the skin becomes more irregular. So you get some patchy changes, you get fine lines. The skin is less elastic, becomes thinner, becomes more lax. If you go to the deeper tissues, we use some volume, some fullness, so we call it fat atrophy. And the tissues become laxer, so everything follows gravity. And you can see here very clearly that the cheeks, which are in the young person in a higher position, which are sitting in a higher position than the younger person, they drop down, they drop to these lines, which you call the nasolateral folds. Similar things happen in the area around the corners of the mouth and the neck, so you get some laxity in the neck with some bands in the middle, and the typical lines that people don't like. And there are further changes in the bone where the lower jaw becomes less high and the upper jaw loses some projection as well. So a number of things that change in the face. As plastic surgeons, we're mainly concerned with the sagging tissues and correcting these.
We've got questions coming in thick and fast, so I'm just going to pick up on some of them. Somebody's asked, what is the youngest person that you would do a facelift on? Do you have an age limit, or how do you assess them?
It depends. The majority of patients are probably in the late 40s, 50s, more 60s. Often a patient who was 42 years old developed some laxity quite early on, and I also have operated on a patient who was 80 years old. So this is the normal range strict age.
No, I feel the same. I mean, we both do a lot of facelifts, and I think as Håkan pointed out, some of it is just general changes of age, but everyone's different, and genetics play a big part in it, the skin quality. So it's really, we have to assess everyone individually, but majority of patients around the age of menopause, they seem to notice the changes more, and they seek to have something done to have it rejuvenated. So what I wanted to really touch up on is Håkan, when I see patients, I don't know about your clinic, but patients often may seek to have a facelift or facial surgery, but they have very little knowledge of what the recovery is, or what their perception of recovery is, or what the outcome's going to be. And Benita, can I just bring you in and just ask you, as a patient, what things worry you about having the facelift? If you would ever consider one, what things go through your head that other people may be thinking the same?
So the thing I think that would go through my head would be I wouldn't want it to look too much. I'd want it to look like I was well rested, or people would say you look really healthy, but not necessarily know what I've had done. That's what I'd really like to do.
Yeah, and I think that shares with many people. So I've prepared a slide because quite often when I talk to patients, they worry that it's a very big procedure, it's general anesthetic, always, few days in hospital, drains, extensive bruising. As you can see, these are images of people who've had these procedures. These are just off the internet. But this is what people worry about, seeing these things. Would you say the same, that people worry about downtime, how long they want to hide away?
Yes, absolutely. I mean, these pictures, they can be quite scary for somebody who's not used to facelift surgery, and I think these appearances were more common in the past, where plastic surgeons try to improve the face by pulling the skin tight. So we've moved away from that, as you know, and the emphasis is now to adjusting the deeper tissues rather than the skin. So if you just pull on the skin, you get much more bruising, there's higher risk of bleeding, and the bruising can take some time to settle down.
Yeah,
but it's on from that, and these pictures are not very common in our practice.
No, that's right. And I think, as Benita pointed out, you don't want to have that look, and that's what scares people. And I think generally, a lot of it is because what we see on TV, it's entertaining, and therefore it makes it onto TV programs, and we naturally associate facelifts with examples such as these, and it couldn't be further from our patients. Our patients, nobody that I know would want to look like this or like this, and the secret to a facelift, as Håkan pointed out, is to not have any telltale signs of surgery, but yet you're younger and fresher. So for the audience watching, I wanted to share some examples of not trying to scare people, because this isn't reality of what facelift surgery is, but the reality is to try and be youthful. And this lady, Håkan, can you tell me, this is one of our Bellevue patients, so can you tell me what makes her look youthful, in particular different parts of the face that makes one think she's looking fresher?
I would say one of the most striking appearances of a facelift are usually the rejuvenation of the jawline. So we'll go into that in a bit, but essentially the aging face gets into a more square shape. And with facelift surgery, this is reversed, the aging process is reversed, so we're lifting up the tissues, the jowl areas, it returns the face from a more square face into a more triangular face. You can also see an improvement in the lines around the nose and the lips and around the mouth, so this lady has a very fresh appearance. What do you think, how old she is?
Well, it's difficult to tell, because I can see a little bit of fresh scarring around here, so I guess from this scar, she's had some earlobe reduction,
Yes.
and she's, I would say that it looks like, just from the scars, that she's not that far from surgery. So
Yes.
how long was this after surgery?
It was 2 weeks after the surgery, and she had several things done together, which is quite common nowadays to do that. So she had the eyelids operated on, the earlobes, the face as well. So
Yeah.
these things can often be combined during surgery, and patients asking for that because the changes that affect the aging face are not just in the face; it is also around the eyelids and other areas. So
Yeah, I mean she looks very youthful, and for the people watching, you know, it'd be nice if you're sitting there trying to guess her age, and at what age would you put her? But the main thing here is that she doesn't look like a wind tunnel face. She looks very natural. She just looks fresher for who she is. Actually, her age is 69, and there is her before picture. And you can see, as Hagen mentioned, this is the squaring of the lower face, the jowls, the looseness of the neck, the visibility of the platysmal muscles, and the tight sunken eyes, and also the earlobes. As you can see, they get elongated because of loss of collagen and volume. And all together, a little bit here and there, is what makes it really refreshing and beautiful. So we had a question from a patient saying, would you ever turn somebody down if they didn't need facelift?
yes, of course, I would do that. So the best outcome is a happy patient. So we do this not only for the looks, but also to keep patients satisfied. There's no benefit in operating on patients that would not benefit from the surgery, that would not get the results they're hoping for. So it is better to turn a patient down and to get a good recommendation from this patient who says, yeah, this doctor was very honest to me, rather than operating on somebody who doesn't need it.
Yeah, and I
You'll
think
probably have a similar standard.
I have the same. So I think suitability of patients, we look as plastic surgeons as whether anatomically they're suitable. That's one element. Whether there are changes in the face that you think can be reversed
Yes.
to make them more youthful. But other factors are also important. Why they want to have it done? What are their reasons? What is the support they've got at home? And do they have realistic expectation of what they want to achieve? So we assess patients all the time, and it's part of our medical ethics to do the right things for the patient and not just do surgery, because ultimately you're going to have an unhappy patient and you've been dishonest. So that's not at all our practice here at Bellevue. So we've had another question, Hagen, come through about scarring. It's very important. You know, on your face, Benita, if you were to have a scar, you naturally don't want it visible. Of course, as a lady, you can hide it somewhat with hair, although not everybody has long hair, and we see different people. And in men, it's difficult, and we do it slightly differently. Have you ever thought about what this scarring would be?
I have thought about that, and I have seen pictures of other places as to where they go and what have you. So yeah, I would obviously want it so I couldn't see it, and to be as minimal as possible.
Yeah.
Yeah.
So scars is what we try and perfect, and trying to refine as much as we can. Of course, if you're going to have surgery, you're going to have scars, but you want the scars as least noticeable as possible. So I've prepared this slide regarding scars. There are many different ways of putting the scars. These are just two examples.
Yeah.
Both me and Hagen prefer this type of scarring. So Hagen, would you mind explaining for people, why would you choose this over that scar? Because to me, or to an untrained eye, they might say, well, this is lovely, it goes in the hair so nobody can see it, it goes at the back in the hair. And obviously here it goes inside the ear and it's hidden. So why would you want to go in front of the hairline and down the side?
Yes. I think these type of scars that you can see on the left side, they are a little bit outdated nowadays. They were well intended, so the idea, as you rightly said, was to hide these scars in the hairline, so that you don't have a lot of visible scarring when you look at the outcome. However, the reality often turns out to be worse than the idea. So what we've often seen is that these sort of scars can lead to hair loss, into bald patches in the area of the temple and of the what we call the occiput of the head. And another thing that happens is when we are lifting the face, we're pulling tissue back. So we're not only pulling the skin of the face back, but also the hairline. And this can shift the hairline and can lead to a very unnatural appearance. So the question is this much better where you've got scars in the visible area? It is better on the long term, and we'll show you some examples shortly. But the scars, although they can be more visible shortly after surgery, they tend to fade really well and well placed and with not too much tension. They are hardly visible if you leave long enough.
Yeah, I 100% agree with Harvey. I think in our practice, certainly we see people who've had facelift elsewhere, and these are some examples of what can happen where you lose that area of the hair. And you can see here, this looks totally unnatural. You can see the scar was placed in the hairline to hide it, but the reality, as Hagen said, when you get hair loss, then you've got a very bold area. Now, this is our scars where you can see the hair isn't shifted.
Yeah.
The scar is almost invisible. And you pointed out about the aging of this scar. So these are some examples of our surgeries that Hagen can talk through.
Yes. So obviously you can see the changes in the scarring over time. Initially there will be some bruising, some swelling, you can see some dry blood. And this is nothing you should worry about when you're having the surgery done. You can see that with time the blood crusts that come off, the scar becomes flatter, so there's a process which we call inflammation, and that means that the wounds are thickened and red and bit more prominent, and this is all improving over time. So it's just a question of patience. And another thing you can see very nicely here is, although the scars are in the visible area, if you think about how the hair grows and how most people wear their hair, they wear their hair down. So this would cover the scars not only in the area in front of the ear, but also in the area behind the ear. And you can see some other things that are changing, which are these lines here. Obviously, if you pull skin, you will have some creases, and they are unavoidable, but the good thing is they will improve with time. So if you compare the early results after surgery with the results after 1 year, you can see this is nothing to worry about, and it's something that improves.
Yeah, so people want to know how soon they can get back to work and day-to-day living. So we've perfected, and we do a lot of facelift. So the idea is to have as least downtime as possible, the least amount of bruising, and of course everyone's varies. But what we say is based on individuals, it can vary a little bit, but within a week or two, once the swelling and bruising settled, you can face people without looking like you've had anything done, because it settles quite nicely. Somebody wanted to know about the aftercare for facelift. So what are the protocols of what do's and don'ts? Are they going to be bed bound or drains? And
I mean, personally, I don't like to use drains, so there's nothing in my facelift patients that has to be removed. The stitches are dissolving; they gradually dissolve under the skin within 4 to 6 months. I don't use drains. I use a bit of compression, which serves the same purpose as drains do. There will obviously be some bruising and some swelling, but there are things that you can do to improve the appearance and healing. So it starts with a healthy lifestyle. Obviously, you need to make sure that you are getting enough rest, which doesn't mean that you have to be bed bound. You don't have to lie in bed, but obviously take it easy for the first 2 weeks, because you want to reduce the risk of bleeding and bruising, and you don't want any sweat or any dirt in your wounds. So this is quite important earlier on. Nutrition is important. Vitamin C and protein is very important for wound healing and getting enough fluids and fresh air. And then local aftercare to your wounds as well. So once the wounds are dry, you can wash them gently regular scar massage is proven to help a lot, and you can use extra products like silicone
When would
gel.
you say day-to-day activities in terms of driving, shower, normal things, not seeing people, obviously that's visual, but in terms of when can they shower, when can they
They
drive?
can shower the next day.
Yeah, I do the same.
Yeah.
I do
Obviously, initially there will be some protection, some bandages around the wounds to cover it. But as soon as the bandage is off, which is usually after approximately 1 week, I'm quite happy for them to shower, wash their hair, and you can also apply makeup at that point. So even if there's
You can
bruising
cover a
and
little
scars,
bit of bruising,
yes,
yeah,
you can
exactly.
grow your hair over, you can get your hair over the wounds, and you can use some makeup, and you can hide most of the features of
Okay.
surgery.
So in terms of the scarring, obviously we see sometimes bad scarring, and sometimes you have to correct bad scarring depending on what they've had. Quite often, there are many factors that can end up with bad scarring.
Yeah.
Some of them is people scar badly, but quite often it's more to do with the surgical technique and about the type of the stitches. And these are some examples of bad scars that we might see. And as Benita pointed out, nobody wants very visible, lumpy scars in front of their ear because it attracts attention, and then people ask, what have you done? So you want it as discreet as possible. So how would you avoid that, Hoglan, with regards to trying to minimize that kind of thing and ending up with nice, neat scar here that you can see at Bellevue?
Yeah. So there are two things to talk about: is how to avoid scars and how to treat them when they have become unsightly. So as surgeons, we are trained to reduce the scarring, especially as plastic surgeons. We try to get them as neat as possible. And we mentioned some factors like lifestyle to prepare yourself for surgery. But from the surgical point, we avoid excessive tension. Excessive tension can lead to these scars. They're called hypertrophic scars. They can appear after a lot of irritation, and they can become quite lumpy. They often settle down to some degree, but I guess that this scar would benefit from further surgery. The good thing is that many scars can be corrected, so even if they turn out to be quite thick and lumpy, if given enough time, you can often revise them and improve the appearance. But it's obviously better if you avoid them altogether.
Yeah.
So if you place the scars in fairly hidden areas where they're not very obvious, and you avoid excessive tension, then you can avoid this sort of scenario in the majority of cases.
Yeah, and that leads me nicely to a point that patients ask all the time about different types of facelifts. So, and we have someone that's asked exactly the same question about different types of facelift. Naturally, now there are a lot of information on the internet.
Yeah.
People read about it, and they come and say, I want a deep plane facelift, I want a smash facelift, is it this, is it that? And there are many techniques. Yeah. And I certainly, in my practice, vary depending on what they need as to what type we would do. But for the benefit of the audience who've heard the terms smash and deep plane, can you explain the difference between the two?
Yeah.
And again, it's the smash and the deeper layers that gives you the nicer scarring. Because if you're just pulling on the skin, you have the wind tunnel look, you've got the excessive bruising, you get the bad scarring. So can you explain to people watching the difference between deep plane and smash lift, because it's often very confusing for patients and they don't understand.
It is very confusing, and I think if you look long enough on the internet, you're getting even more confused. So
That's true.
if you're even talking about smash lift and deep plane facelift, if you ask different surgeons, they have different ideas about that. So I'm not going very much into details about this. But just to explain to the audience, the smash layer is a layer which contains some muscles and some fat tissue, and basically this is the layer that becomes saggy. So it's between the skin and between the underlying bones. So that becomes droopy. So if you're talking about smash lift, that means usually that we try and lift up this smash layer from its underlying structures and tighten it, which gives better effects than just to pull on the skin.
Yeah.
So there are some people that say that this must lift involves just lifting this as a separate layer, and that a deep plane facelift does not lift it up as a separate layer and just goes underneath and lifts up this SMUS layer with the skin, which gives you less bruising in the surgery.
Yeah.
So the principle essentially is that SMUS and deep plane facelifts both address the droopy tissues which cause the signs of aging.
But of course, these things are very individual as well. So if you're looking to have something done, if you have any questions, as we mentioned earlier, our consultations are free. So put your comments in below. And if you want to come and see us regarding any facelift questions, then by all means, me, Hagen, everyone here at Bellevue will help give you more information about what's suitable for you, because this kind of thing is very bespoke, isn't it? Depending on your age and what you're after, as what can be achieved. Quite often people want to know if they can avoid having a general anesthetic for a facelift, especially my patients where they say for something cosmetic, I don't really want to put myself under a general anesthetic. And the terminology between local anesthetic or sedation can sometimes be confusing. So both myself and Hagen perform these procedures under general as well as local anesthetic. So Hagen, will you explain in terms of suitability how you would assess whether if somebody comes and says I want it on the local, what things do you look for? Do you just do what they want, or do you sometimes feel that what they want cannot be achieved on the local?
I mean, I would be honest with patients and tell them if a facelift can't be done under local anesthetic. But if patients are interested in having it done under local anesthetic and they're suitable, then this is something that can be offered. So with local anesthetic, there are two factors to consider. One is, can you numb the area? And yes, you can. So there's enough local anesthetic available without getting into the dangerous toxic range to do the local anesthetic. So that is very well suitable to numb the area. Another factor is how well are patients psychologically coping. That has also something to do with the operating time. The question is, even if you can keep the area numb, would you be happy to lie for 3-4 hours, or depending on how long the facelift takes in the worst circumstances, would you be happy to have that done under local anesthetic? And even if you can numb it, there might be circumstances where you think maybe the general anesthetic is better tolerated. But the short answer is yes, you can do the facelift under local anesthetic. You might not be able to address all features that you can do under general anesthetic, but depending on the degree of aging, this is certainly doable, and I've done quite a few.
Yeah, I would, in terms of local, when people want to know what is it like, how does it feel, firstly, it's a little bit similar, I guess, to going to the dentist. Just like the dentist numbs your gum, it's numb, you don't feel pain, however, you feel the vibrations of the tool. So with the facelift, it's the same. The cutting, the sensation of pain you don't feel. It's completely numb. But you're talking absolutely fine, and you feel the pulling and tugging. And naturally you can hear noises, you can smell a bit of burning, but you can't see anything because the surgery is done around your ear, and naturally you can't see your ear. So there's nothing visual that you'll see. If you're interested to know how that's done, we have some, my facelift procedures are called concept facelift, and you can look that up on YouTube. We've got videos of people having it done on the local, completely awake. The other point is sedation. So sometimes people say, is that the same as sedation? Sedation is slightly different because they give you drugs to make you drowsy and you won't remember. Whereas with local anesthetic, you're completely awake, you're having a conversation with your surgeon while that's being done. I personally don't choose to do sedation because with sedation, I feel the patients are neither asleep or awake, and they can sometimes do movements where when you're doing intricate surgery and you don't want to cause any damage to any nerves, I don't want to have those movements. So I'll either have them awake, asking patients, can you look to one side so I can do what I need to do, or they sleep and I can get on with it and do that kind of surgery. Would you say the same?
I would say the same. I think the important thing to understand is that there are two aspects of pain. One is what you actually can feel, the pain that you can feel, and the other aspect is how much you're bothered about it. So if you're sedated,
mentally, if you keep thinking about it, you get anxious. That's right.
You might still feel it, but you might be more relaxed and less bothered about it.
We've had another question about somebody who's asking if they've had surgery elsewhere, can it be fixed? Can you assess them?
Yes.
And the answer is yes, because me and Hagen, we operate over 500 facelifts a year. We do revision cases, we do new cases, we do people who've had facelift and some years later they want another one. And we assess everyone individually. So as we mentioned before, our consultations are free. If you've got any comments, then put them in the bio below and do get in touch with us. But of course, individually we would assess to see, is it the scarring needs correcting? Is it the asymmetry? And for all those things, of course, we're here to help you. One of the other patients earlier asked a question about having had a facelift, and as a result of facelift, they've developed a pixie ear. A lot of people don't know what a pixie ear is, and of course, it's a complication of a facelift. I've got a picture prepared here just for the benefit of those people who don't know what pixie ear is where the earlobe gets elongated into a point and gets pulled down because of the poor scarring. So although you can't see in this picture any visible scarring underneath, there's too much tension on the earlobe. So Hartman, can you explain when somebody's got this, can that be fixed? Can it be corrected?
It can be fixed. Again, going back to prevention, so we know how to prevent this and how to place the scars and the tension so that this happening, the risk of this happening is fairly low. But if it happens, it can be corrected. So this problem arises usually from the skin pulling the earlobe down. So because the skin has been fixed to the earlobe rather than to the deeper tissue, there's nothing stopping it from coming down. And we often see after facelift surgery that the tissues change. So what you see on the operating table is not what you see 6 to 9 months down the line. So with time, the skin will relax, come down, and can pull the earlobe down. So we would know how to prevent this or to reduce the risk of this happening by placing this. But once you have this, it can be corrected, yes. So the correction is very simple in most patients. So you just do another lift. So if you lift up the skin, pull it back and fix it in a position where it's less likely to drop down, you can correct this. If there's too much tension, in very few cases might end up with a small scar, but in my experience, that's not necessary for the majority of cases.
I think the main thing is that as plastic surgeons, we're aware that these things can happen. And as a result of that, good planning prevents these kind of things or minimizes them. And of course, if you need them corrected here at Bellevue, if during your healing something's not quite right, then we would address that with no cost to you, because our pledge is to our patients to make sure we get them from A to B. And if there is a complications or issues, then of course we would be there to correct them. The next slide I want to talk about, I know we're talking about some of these complications, but it's important to be aware, perhaps some of these, Benita, you weren't even thinking of, but once you know, it's quite a big topic, and it's trying to avoid all these things that can go wrong. And we see very little of this in our practice, but it's important that patients are fully educated and they know about it. Everyone, I'm sure, has heard time and time again about don't smoke when you're having surgery, any kind of surgery, especially facelift surgery. And there are reasons for that. I've got a slide here of a patient who's had a facelift and developed, as a result of smoking, a complication. You can see here she's got really severe infection that's caused swelling, edema, redness all around her face. And she's got part of her skin that's died. Of course, this skin would have been lifted and pulled, so the blood supply is already compromised. And as a result of the smoking, you're increasing the risk of getting these problems. So I'd like to ask Hagen, for the benefit of people who don't know why we keep saying don't smoke, and for so many weeks before surgery, what is the actual rationale behind how this can happen?
Well, it is a combination of what we do and what the tissues need to heal. So as plastic surgeons, especially with facelift surgery, we're lifting up tissues to move them around. So, and you can imagine that it's easier to move skin around when we've lifted it up. So with the lifting, we are also cutting through the blood supply. So basically the skin survives on less blood than normally. So what smoking does, it effectively reduces the amount of oxygen to the tissues. And that's not only in the nicotine. We all know that nicotine makes the blood vessels tighter. There's also carbon monoxide, which displaces the oxygen, then good oxygen from the red cells.
So you're starving the tissue of oxygen.
Yes, exactly.
You're just slowly killing it.
Exactly. Yeah. So you've got a mismatch of tissues that need more oxygen, and you supply less oxygen. And this can lead to a number of complications. So this is called necrosis. It's black that skin essentially. So if you look on the internet, just Google necrosis, cosmetic surgery, smoking.
Of course, Halloween is coming up, so if you want to get a bit of horror, whatever it is.
Yes, but you can also get things like nasty scars, wound infections, as you rightly mentioned.
Yeah, and again, lack of blood supply, so the bugs can multiply and spread, and it becomes real problematic. And of course, you don't want something like this on your face.
Yeah.
So when we say it's best to reduce smoking, the reason is that if you optimize your health, it's your face, you're spending money to get the best outcome. We bring our expertise of many years of doing these kind of surgery to give you the best result. So it's really important that you optimize it and avoid these kind of risks that can be avoided. One of the big topics we've not really talked about complications is that it rarely happens, but when it happens, it's devastating.
Yes.
And that's facial nerve injury. We always tell our patients there's a risk of it. It's as rare as hen's teeth. I've personally seen a few, but quite often by patients who've not done their research and they've gone to someone that doesn't do many facelifts. Although it can happen to anybody, we want to avoid this kind of thing as much as possible. So it's important that you find a surgeon that does many facelifts, those that are aware of these risks so they can avoid them, and also those that have least complications of such results. And of course, you can ask them if you've ever had a nerve injury. So, Harpen, can you talk a little bit about nerve injury? Because there are different nerves, and people sometimes don't understand different nerve injuries. Because some everybody gets, and some like this is very rare and ought to be avoided.
Yeah. So we've got two types of nerves in the face. Some nerves, they give you sensation, so that's why you can feel when you touch your face. And it's quite normal that this is reduced after facelift surgery. It's nothing to worry about. In the majority of cases, this all settles down. It's very rare, very unusual to have.
It can take a long time, though.
It can take some time. It gradually improves, but it does improve, and it's unusual to have long-term damage. So the other type of nerves that can be found are what we call the motor nerves. So these are the nerves that move your face, so that you can give some grimacing, and it can help you to raise your eyebrows and to move your mouth and your eyes. So these can be irritated. Going back to the facelift surgery, if you want a very significant improvement, most patients would probably opt for the SMUS facelift. So the nerves travel very close to this layer, so they can be irritated, which is not unusual. But the good thing is that this is a temporary irritation, and it often settles down. So we talk about this with patients quite extensively, so that there's no worry if this happens, which is not very unusual. There can be some weakness, and that often settles down in days, weeks, rarely months, but permanent nerve damage is fortunately not very rare. and we know how to minimize the risk and how to reduce that.
So we've had a question about obviously these complications. Of course, as plastic surgeons, we can correct many of them. And if necrosis happens, somebody wants to know how can that be fixed. And again, it depends on the extent of necrosis. It depends on where it is. But generally speaking, it does take time. But with dressings and proper cleaning and management, you can improve that. Of course, as plastic surgeons, we do lots of big reconstructions for cancer and reconstruction, so that's part of our training. So we can always reconstruct and correct things. However, you still need to optimize your healing, because if you continue to smoke, you're going to compromise that. Pixie ears, other deformities, they can be corrected. Hair loss, it can be corrected. You can do a hair transplant, but it's just not necessary. If you can avoid them in the first place and not have a nerve injury, not have a hair loss, those things obviously would be beneficial.
Yeah, no, I agree. So somebody asked, what can we do about necrosis? How can we fix it? I think in my practice, I would just wait for a long time until this is all settled. The good thing is if you clean the wounds, if you remove any dead tissue and let it heal, most scars are actually not very visible on the long term. So the face heals really well from my experience. With nerves, fortunately, I have not been in the situation where the nerves had to be repaired, but should that happen, it is possible to explore, to have a look for the nerves and try and connect them. The timing is quite sensitive because you don't want to go back too early when the nerves have a potential to improve on their own, but you also don't want to wait for too long until it's irreversible. So it takes a lot of patience, and you often wait for over a year for this to settle down.
Okay, so another question we've had about how long does a facelift last? I always find this quite fascinating because when we see patients with breast surgery, tummy surgery, they never ask how long it lasts. But for face, always, how long does it last? They want it all documented. Of course, it's very variable, and I think Hagen would agree that depending on what age you have a facelift, depending on what your genetics are, your background, your lifestyle, whether you're a smoker, whether you've sailed around the world for 20 years and you've had a lot of sun-damaged skin, all of these play a part. But there's good evidence in the literature to say that when you're dealing with the smash layer or the deep plane, which is what we do, that the longevity is many years. And again, it varies if someone's having a facelift at 80 or someone's having it at 40, because the skin laxity isn't the same. So you can't compare, apples and pears and say how long will it last. So it's something that we try to give as much longevity as possible to patients, but it's also about having a natural result and longevity, not just pulling them so tight so they look ridiculous for 5 years, and then another 5 years of looking good and another 5 years of deteriorating. My example to patients is that we set the clock back to how you used to look, a fresher, younger version of you. But of course, day by day we age, and nails gradually grow day by day as hairs grow gradually. And sometimes people want to know, when can I have another facelift, or can I? And the answer to that is when it bothers you and enough laxity is there, that can be done. And going back to the previous question we had, would you turn people down? If there's not enough to do and some non-surgical things would benefit, then why put yourself through the surgery? Because obviously things can go wrong, so you want the best benefit and the right surgeon and right environment and the right time for you to have it done. So how many facelifts can you have?
That's not really a limit, so everybody ages differently.
The speed limit.
But what I tell my patients is that the average improvement that you would expect is around 10 years. So the important thing is that as plastic surgeons, we can tighten the skin, we can give nice results on the operating table, what we can't do is improve your skin quality. So if patients have a tendency to develop a lot of laxity, the facelift might last 5 years, might last 20 years in some patients. So there's no strict rule. The average is maybe 10 years, but yes, you can have facelifts redone, and many people do that.
Yeah, sometimes people have a facelift much later in life. I had a gentleman who had a facelift at the age of 86 for the first time. I was curious, so I asked him, why at 86? And he said, my grandchildren grab my jowls and I just hate it.
Yeah.
So the people have different reasons. On the other hand, I had the oldest patient that I did a facelift on was 94.
Yeah.
And people think, well, why would you operate on a 94-year-old? Well, she had no family, no kids, had a 60-year-old boyfriend. She went ballroom dancing every week. And she just wanted to enjoy life.
Yeah.
And she had 3 previous facelifts, but nobody would give her a general anesthetic, and she wanted it done safely on the local.
Yeah.
So horses for courses, and there are different reasons. So if you have any questions, as we said before, our consultations are free. So put your comments below, and if you want to come and see me, Hagen, we look forward to meeting you. So before we run out of time, because we always do, we have so much to talk about, and there's such a big topic, Benita kindly has volunteered to come here so we can demonstrate to people how we look at a face and how we would mark up different areas for doing the facelift. So she's volunteered with a permanent marker, so it's always on a, no, we're joking. So we're gonna put a marker that can be rubbed off. But for the benefit of the audience, and thank you very much for coming. Benita actually was a past patient who had her eyelids done, and she's still here, so she must be happy with the result. So before we mark you up, Benita, can I ask you some questions about eyelids? I know we're talking about face today, but within the face, there are many things. Some people want the brow lift, upper eyelids, lower eyelids, cheek lift, lip lift, face and neck lift, and many things. So what prompted you in the first place to come to us and have your eyelids done? What was bothering you about your eyelids?
I just felt like the skin at the top was sort of drooping down a little bit. So, and I just thought that it sort of closed my eyes a little bit.
I know how you feel.
So, yeah. And I could twist a bit of skin around. Time to go.
Did it affect the way you applied makeup?
Yeah, so when I used to put mascara on, it always used to smudge at the top. So, yeah, I've never wear eyeshadow or anything.
Was it worthwhile? How long ago did you have it?
So I had it done about a year ago, I think now. So yeah, amazing. I'm really pleased that I had it done. So yeah, and I don't actually wear eyeshadow, and so you can't even see the scars or anything.
That's
so
good.
Yeah, it was amazing. Yeah.
Does it boost your confidence
Definitely.
too? It's,
yeah, and people have said to me, "You look really well." Obviously, they don't know.
good. Well, I'm pleased.
Yes.
So obviously we've done something right.
Yeah.
You're here to be, for us to draw on. So, Hagen, would you kindly, Benita, if you get you closer in front of the screen, I'll just get that the screen corrected. So Hagen's gonna do some markings here, and for the benefit of our patients. Hagen, would you firstly just show some of the terminology we use when people say, my nasolabial lines, marionette lines, jowls. What areas is that? So he's going in with the orange pen. It's not too bad. He gets started. Okay.
So obviously, this would happen during a consultation when we see patients. So we assess the face. We know generally that the tissues go downwards and become saggy. So what you can see here is that the cheeks are coming down a little bit. They're coming down from a higher position, coming down a little bit. They can't droop much further down. There's a structure here which we call the nasolabial lines. So just make some dots on them. So the connections between the skin and between the muscle, and this is the reason why the tissues can't fall further down, and that's why it accumulates here. And something similarly happens here in this area, so they call it marionette lines, or the medical term is the labiomandibular lines. So you can also see sometimes some lines here at the angles of the mouth, and patients hate that because it gives you the serious and not very happy appearance. And then you can notice maybe some fullness in this area here, so that they're called the jowls, and that's what we mentioned before, that the face turns from a more triangular shape into a more square.
You start to lose the definition of your jawline.
You do, yeah.
Yeah, that's what I've noticed.
Yeah. And then furthermore, you can notice some laxity in the neck, so it's not very visible here. But sometimes
if you turn it to the camera a little, and you can just bring your chin down a little bit.
And then as time progresses, sometimes patients can notice some lines here, so they're called platysma bands. So if I look very angry like this, then you can see some
I've never
lines
seen
here.
it like that.
Yeah, because I'm not very angry. So, but these are all signs that you can notice with time. So
Perfect.
basically what we are trying to do, we're trying to reverse that. So how are we going to do that? In the past, the facelifts were just, can I just pull? So they were just pulling the skin backwards, and that could give you this windblown appearance. So what we do nowadays is more sophisticated. So we're trying to lift the droopy tissues and then drag the skin over it. So they're called vectors.
Turn you around a little bit again like this. So if you draw the vector that you were talking about.
Yeah. So the vectors are the directions where you want to adjust the tissues to. So we know that the cheek tissues are dropping down this way. So we try and lift them up to the outer and upper aspect. So we try and move the cheek tissues and the what we call the malar fat part, or the fatty on the cheeks. We try and move this up, and you can see there's already an improvement just with a little bit of pull. In the neck, the vector goes slightly different, so we pull it more to to horizontal line. So we try and make this really tight. So if you look into the camera, please. That's fine. So we try and pull this back here, and we also try and improve the vector here. So
it lifts the skin up, doesn't it?
Yes, and that follows a bit more parallel line here, the lower you go. So we're trying to adjust these vectors, which are going a little bit more up than vertical. So the skin will then also be lifted up, and we've got some excess tissue then that we trim off at the end of the operation.
And you can see the way, if you just look at the camera, the way Harper's drawn it, so it's that lift of the cheek, so it softens that line, softens the marionette line, improves the jowl, so it gives you a sharp jawline, tighter neckline. Of course, it doesn't change the eyes, but it's that kind of improvement that keeps the appearance looking the same rather than really swept, and just getting that improved.
Yeah.
Lovely.
Could I ask you to turn around now to the right, and I'll show you now how we would place the scars. So I think we do it quite similarly as we just said. So we will always keep the scars as close as possible to the hairline. So the scar would follow along here. And there are some notch lines where we can hide the scars a little bit, so that would go along this structure here, which is called the helical root in technical terms, and then go behind this small structure, which is called the tragus, and then goes around the earlobe, very tightly in the notch crease here. And at some point it curves over and then follows the hairline as close as possible to the hairline. And you can imagine once the hair falls over and everything heals, most of the scar will be hidden. What I find in practical terms is that the scars which are around the ear, which is in theory more visible, heals really well.
Yeah,
so this is a part of the scar which is not very noticeable.
So the other, if you turn around again, the other point here was that within the neck there are different things. So within the neck there is the skin, there's the fat under the skin, there's the muscle, the platysma that you can see the bands, and there are deeper fat deep to the muscle, and of course the salivary glands. So these sometimes need to be addressed depending on what people want. So with the platysmoplasty, as some people have heard, how would you address that? How would you get those muscles addressed so they're not visible?
I would use a very small scar, which is under the chin. It's hardly visible in most patients. If you look at me, you wouldn't know if I had a facelift. I didn't have one, by the way.
You just look young.
I just look naturally young, absolutely, yeah. But if you just lift up your head a little bit, So there would be small scar which you would place somewhere under the natural line, something like this. We would then lift up the tissues, remove some of the fat, so some patients have some fullness under the chin, and we can trim that through a small cut. And we would then stitch these two parts of the muscle together. And what I also do in the jawline, I just make a small cut in them to emphasize.
And it gives you a nice angle, doesn't
It
it?
gives a nice
And
angle.
also you're pulling the muscle together, and then you're pulling the muscle back as well. So that gives you a nice trampoline tight neckline and a nice profile.
It is like a hammock essentially, trying
Yeah.
to create a hammock here to suspend the tissues and to give a really nice definition of the jawline.
But that's great. Thanks for the demonstration. Benita, thank you very
You're
much.
very welcome.
It was a pleasure as always.
Thank you so much.
Thanks for coming
Thank
in.
you.
Much appreciated.
Thank you.
Bye-bye.
So, Hagen, we are very quickly running out of time. Many questions coming in. Of course, we're not going to have time to go through it, otherwise we would never operate and we would just be here all day, all night. So we're gonna whiz through some of classic examples of patients that we have at Bellevue, some of your patients. You can see here a before and after, and you can see what a lovely result. Nice jawline, smoother neck, refreshed face. You can't see the scars, earlobes nice and beautiful. And again, it's not about people saying that, gosh, have you had something done? Because that means it's obvious and there is some telltale signs of surgery. But it's rather, you look well, have you changed your hairstyle, have you lost weight? And you can see she just looks like a younger sister and a younger version of herself. Beautiful result. This lady, can you tell me a little bit about her, what she had done?
Yes, she had several procedures done around the eyelid area and eyebrow area, and she had a deep line facelift and a general anesthetic. So she had the tissues, so the saggy tissues, pulled up into this direction, so which improved the nasolabial folds, the lines here around the mouth area, and mainly improved the jawline. So you can see there's an improvement of the jowling area.
Yeah, you can see
it's generally fresher.
And as you said earlier, it's this long face, square face into a nice heart-shaped, youthful appearance, which is what we're after. Again, with this patient of yours, you can see lots of lines here, but nice and soft, subtle, youthful, less lines, beautiful result. We talked before a little bit about some of the changes in the face, and we said sometimes with the aging process, some people lose volume in their face, and this is another example of what we've talked about. You can see, as well as the squaring of the jawline, the long face, there is a lot of fat that's lost and the face looks a bit gaunt. And this lady has obviously had a facelift, neck lift, and volumization.
Yes.
Different way of volumization.
Yes.
Can you quickly tell us about how people can get the volume replaced?
Of course, there's several ways of doing that. Everybody knows about fillers have a certain lifetime. In theory, in practice, they often stay much longer than people anticipate. The problem is they're spreading out. They don't have a lot of definition. So if you're looking at more natural long-term results, you can think about fat transfer. It's what we both use quite a lot. So fat transfer has to be topped up sometimes. Part of it survives. Part of it has to be.
But in the face is quite good, isn't it? Because it's quite vascular, and then it's permanent because once it's there, it's there. So another picture quickly. Platysma bands we've talked about, as Hagen mentioned, the small cut under the chin to repair that, and you can see the results, and it obviously improves your profile. Another picture I wanted to comment on, sometimes younger patients, we talked about different things in the neck, and it's important to see and examine you. So this lady had quite a bit of fat under her skin, and of course she's had some liposuction
Yes.
That's improved.
Do the face
So
lift
sometimes
and
it can be as simple as that.
Yeah.
We've had some people who send pictures through. We've had many things, but we don't have time to go through all of them. So we're just going to show this lady that sent her pictures through, suggesting what can be done. So although we haven't examined her, Hagen, just on the pictures, what would you suggest for this lady?
So what I can see is that there's some fullness in the jowl area on both sides, and there's some generalized fullness under the neck, a bit of loss of definition of the neck structure. So what I would suggest is to tighten the tissues, a facelift, but also combined with some fat removal, which I would do through a small cut. It could be done with liposuction as in the other patients, but because the platysma muscle could also be tightened up in this case.
You get a much nicer profile.
You would get a nicer profile.
Yeah.
Yes.
And I think it's about doing a little bit here and there to get the best results. So this lady would benefit from that, certainly. Another slide, this lady also was inquiring about some of the early changes that you can see. I can see she's getting a bit of deep nasolabial lines, marionette lines, and the jowls appearing, and the position of the neck. So what would you do for this lady?
Similar, I would do facelift for this lady. It's important, in my view, to release the attachments between the skin and between the deeper tissues, so that allows
It's a nice contour.
Move tissues back and to lose this structure here, the jowling area. The neckline is not too bad, but it would still benefit from slight tightening. You can't see a lot here because of this smiling, how much laxity there is, but in most cases, with a similar appearance, there would also be a benefit of tightening
Absolutely.
tissues.
Well, we're rapidly running out of time, but for those of you that have many questions and you want to be able to ask more things, then feel free to book a consultation. Then our consultations are free. We can assess you individually. Both myself, Hagen, and everybody, all the team here at Bellevue, look forward to seeing you. People want to know, is there aftercare included in the price of Bellevue? And that's something that is so important that you know about. Here at Bellevue, we're here to look after you for your whole journey. There are no hidden costs to any garments, dressings. If there's any issues with wound healing, if you need dressing, if you had a complication, you need to go back to surgery, you do not pay a penny. So we're here for you to make sure that we're transparent, that our prices are what we say it is, and we get you from A to B. So we bring expert surgeons here at Bellevue to make sure that they have the best care, and we all have the same ethos of looking after patients and making sure they get great results. So for those of you that are seeking surgery, it's always important wherever you go to do your research and ask about the aftercare, because once you have a complication that can happen, you don't want to suddenly find that you have to pay another few £1,000s. And some places, the surgeons may waive their fee, but you still have to pay anesthetic or hospital fee. Here at Bellevue, we take care of all of that so that we can get you the best result. So, Hagen, we're going to say goodbye.
Goodbye.
And thank you very much for joining us. So any more questions, please come and see us. We look forward to meeting you in person.